Roleplay. I'm Nicola. Thank you for being here today. It's a really big step. You should be really proud of yourself. Okay. Admitting that you need help is a huge step, and it's a good step, and you've done that. And then the next huge step is actually being here, starting the journey to a better mental health. Okay? And you've done that. And I am extremely proud of you. And you should be too. Okay. Good. We're going to take our time. Okay. Let's just take some nice breaths. Alright. That's it. So in through the nose and out through the mouth, okay. That's it. Alright. I like to do that at the start of our sessions just to help relax you and feel your environment. Okay. There is lavender in the air, which I'm sure you can smell. Again, that's just to help relax you and get used to your surroundings. Okay, good. So, I can see that you're under quite a lot of pressure at the moment. Yeah. And I'm here to help you, and we're going at your pace, one step at a time. Okay. At any point, if you don't feel comfortable, please let me know. If something is difficult for you, we can take our time. Alright, good. This session is a full mental health evaluation. I'm going to assess you in very detailed manner. Okay, there's going to be a lot of questions, and I would like you to elaborate on some of those questions. Okay, but I want you to share what you are comfortable with, but I need you to be as honest and open as possible. The more I know, the more I can help you. Okay, good. You have some tissues next to you, and you have a glass of cold, fresh water the other side. Please get yourself comfortable with those lovely fluffy cushions, okay? Feel free to recline your chair a little bit or stay as you are. Alright. You're more than welcome to take off your jacket, but if you feel better, then please leave it on. Okay, good. So, I just want you to compose yourself. Alright. Please don't worry. You're in perfectly safe hands. I'm not here to judge you. I'm here to help you. So please don't feel like I'm judging. I am assessing you, but I'm not judging you. Okay. This is a safe place. Alright, it's just me and you. Okay. Everything stays in this room. It's just me and you. Okay? Good. We have a lot to get through, but I'm not going to rush you. We have got as long as you need. Alright? Good. So, before we start the assessment, I do need you to confirm your full name for me and your date of birth. Okay. Can I take your name, please? And your date of birth. Okay, thank you very much. So, I'll be asking all sorts of questions about your life and your mental health, physical health, etc. Okay. I will also be assessing your behaviour and how you are and things like that. Okay, but please don't worry. I will be writing a lot of things down, but it's really important that I do that. And rest assured, I'm not judging you, and I am listening to you. I'm here to listen to you because you deserve that time to be listened to. Okay, good. So, the first thing I'm going to start with is just asking you a few basic questions. Okay, so this is your first time under the mental health services, isn't it? Okay. All right. Right. Who is your doctor, please? And what surgery? Thank you very much. Do you have any physical health issues? Is that everything? Good. Are they controlled? And everything's okay? Good. When did you last have a full health check? Okay. What is your nationality? Do you mind telling me your gender or what you identify as? Okay. And what pronouns do you use? Okay. Thank you. Do you mind telling me your sexual orientation, please? Okay. What's your marital status? Okay. Do you have an occupation? If so, what is it? Okay. Do you do recreational drugs? If so, what? Do Do you drink alcohol? If so, how much? Do you smoke or vape? If so, how much? Thank you. What is your housing situation? Are you living at home with your parents, partner, rented, mortgage? How is it for you? Okay. What is your financial situation? Are you in debt? Are you alright for money? How is it for you? And is that okay, or is that affecting you mentally? Okay. And how much? Okay, that's fine. And you're alright with that, so that's not particularly having an impact. Good. Okay, do you have a religion at all? Okay. How is your diet and exercise? Okay. Okay, I will ask you further questions about that, but at the moment that's enough. Okay, thank you. Don't worry. Great, thank you. How would you say your well-being is overall? Okay, it's fine. It's alright. You don't have to elaborate. Okay, like I said, at your pace. Okay. Right. How is your social life? And do you have any friends? And how's your family life? Okay. And would you say you've got a good support network, or? Right, okay. It's them not understanding. Yeah, I get that. It's very common. Do you have any dependents at all, such as children, or are you caring for anybody, elderly, etc.? Okay. Thank you. Do you have any disabilities at all, including any learning disabilities? Okay. Excellent, that's fine. Great. Are you on any medication at the moment? Okay, and what's that for? Anything else? And are they all controlled and regularly monitored? So you don't take anything for your mental health at the moment? Have you ever had any issues with your mental health before? And what about any family history of mental illness? And what was that? Yep, okay. Okay, that's fine. Have you had any bereavements at all? Yeah, it's back as far as you want to go. Do you have any fears or phobias? Not necessarily diagnosed, but anything like scared of lifts, heights, thunderstorms, anything like that? Me too. Anything else? Okay. Do you think of anything along the way? About anything at all? Please just let me know and I can just jot it down, whatever it is, okay? If anything comes to mind, just let me know. Okay. Good. Now, I want to ask you about your past experiences. So, have you experienced any trauma at all in your childhood, teens, etc.? Anything at all? It could be, anything mentally, physically, sexually, or anything like that. So any kinds of abuse. I know it's quite a hard subject, but if you can try to be honest for me. Okay. Just take your time. All right. Yeah. It's quite young, isn't it? And was that partner at the time? Yeah. Does anyone know about that? Okay. And have you ever had any help with that trauma? Alright, so you still bottle that up to this day? Okay. Do you come from a broken home, if you like? Are your parents still together? Have they split up? When did they break up, etc.? Okay. So that was quite just before, really. So you're quite young. Okay. And how were things for your mum after that? Yeah, so you had to step up a little bit and grow up quite quick. Yeah. Do you have any siblings at all? And younger. Poor thing, I bet that was a lot to take on. Alright. Okay. You're doing really well. Thank you for being honest with me. Alright. Okay, so I think that is the main book to start with. Excellent. Next, I would like you to tell me your symptoms. Okay, so how are you feeling? That's the first thing. I don't mean right now, I mean just in general. So you're here for a reason, so you tell me what has made you come here, what made you get help, what are the symptoms that you are experiencing. Yeah. Yeah, so some things you might not realise it's a symptom or something like that, but just the kind of the obvious things to you. Okay. Yeah, it's quite a hard question. Can you think of anything else off the top of your head? Okay, don't worry. We will be able to get a bigger picture when I ask you the other questions, okay? Perfect. Okay, so what does mental health mean to you? What do you think it means? What does it mean to you? Yeah? Yeah. Yeah, so like how feeling, emotions and things like that. Okay, great. Now, how are you feeling right now? Just think about it. Before you tell me, just think. Really think about how you're feeling. Okay? Okay. All right. Yeah. Being scared and nervous is quite a normal feeling. You're here taking that huge step towards, helping your mental health, and you're here with somebody you don't know in a strange environment. So them are quite normal emotions. Yeah? So carry on, you tell me how you're feeling. Mm-hmm. Okay. Anything else? All right. Right. This is talking about the last few months, particularly, okay? I mean, I know you've had quite some trouble for quite some time, but I just want to concentrate on the more recent months, okay? Are you doing anything differently to what you were doing before? Okay. And has that been pretty much the same longer than just the last few months? Okay. Are you currently working or are you off on sick leave? Can you tell me about your eating habits? How are they at the moment? Okay. Right. Is that more of a comfort thing? Okay, so you kind of, yeah, that makes sense. So you've not really got much desire to eat, but if you do kind of pick out a little bit. Okay. And is that different to how it was prior to 2 months ago? Okay. Can you tell me about your sleeping habits? How many hours roughly a night? Would you say you're a light sleeper? Do you have restless sleep, disturbed sleep? You have trouble falling to sleep? And what about waking up? Do you find it quite difficult? And do you ever feel refreshed when you wake up? Or is it quite lethargic? Okay. Have you ever had any sleeping tablets at all? And how were they for you? So hit and miss, not particularly very helpful. Okay. Right, so would you say any routines have changed? Anything that you would say do religiously? Has that changed? So maybe like getting up, having a shower, from breakfast, things like that. Has your routine changed at all? Okay. How would you say your personal hygiene is? I mean, are you managing to shower, brush your teeth, get dressed in the morning? Yeah. Okay, well that's good. Okay. Are you managing to do your housework? Are you on top of it? Yeah. This is a really important thing. Yeah. Okay, thank you. Are you having any physical symptoms at all? So, for example, are you sweating, having heart palpitations, are you feeling dizzy, weak, sick, anything like that, tummy ache or things? How often's that? So that sounds like suffering with a little bit of anxiety. Okay, and then that kind of flares. And would you say you have a panic attack, or is it, say, more of like an anxiety attack? So panic attacks, you could be hyperventilating and things like that. Yeah, an anxiety attack, you know, you have full effect of that anxiety and it's crippling feeling, and you say just curl up on the bed and don't want to speak, for example. What kind of thing is it? Yeah, I thought you would say that. Okay. And how often does that occur? Okay, so sometimes you get your anxiety without necessarily any physical symptoms. Okay. Thank you. Has your thinking changed at all? Would you say you're thinking different now to what you were before? So we say you're more of a deep thinker. Okay. Analysing things. Okay. And has that just got worse, or is that something new? So you'd say your thinking is quite negative. Yeah. Do you ever think anything positive? Okay. So you're always quite a negative person, and is that pretty much something that you've always kind of experienced? Are you one of these that it's a bit like me? I always think the worst. So if the worst happened, I don't feel let down. Yeah. I mean, personally, I think that's a sensible way of thinking, but most people say that's not very healthy. Yeah. So you said your energy levels are quite low and you're lethargic and that. So does that impact your motivation? Okay, and besides from the lack of energy, is your mental health affecting your motivation? Do you feel like you just can't be bothered, and you're just not interested in anything? And yeah. So how does your future look to you at the moment? Yeah, you can't see one. Yeah. And how long have you felt like that about your future? Do you feel like there's just no end in sight for your feelings? And yeah, and you're not particularly bothered by the future. That being said then, how does that make you feel like ending your life? And how bad's that for you? Alright, take your time. Take your time. You do really well. Okay? Good. And how often do you experience that? Yeah. It's pretty much there all the time. Okay. That would lead me on to, do you hurt yourself at all, self-harm or anything like that? And if you do, what do you do and how often? Okay. Yeah, so that makes sense. So sometimes we can just hurt ourselves in any way, and we don't necessarily self-harm because we're trying to end our life. It's to take away the pain that we're feeling, and it's a coping mechanism. So sometimes just say holding something sharp against your skin is a relief. Things like that are a form of self-harm. Yeah, and is that something that you kind of do? Yeah, so with the cutting, are we quite lighter cuts? Do we ever go quite deep or anything like that? And this has been quite a long thing. Yeah. Thank you for being honest. Would you say you worry a lot? What kind of things do you worry about? Okay, so pretty much everything. So what to eat, where to go, and things like that. And then are we kind of worrying about being alive or seeing people, things like that? You just tell me all the things that you can think of that just worry you. So would that be any illness in particular, or is it just kind of anything? So that would be that. And how do you feel if you know someone's ill? How does that make you feel? And do you do anything to make yourself feel better? Yeah. So you would say excessively wash your hands, okay, and how many times are we, like a certain amount to make you feel comfortable? What is that? Okay, and would that be every time? What makes you do that ritual? What is it? Okay, so you think something's bad's going to happen, such as, okay, so you're going to get ill. The question I'm going to ask you now, I don't mean this in a condescending way or anything like that. If you were to get ill, what is the worst that could happen if you got, just say, a cold or tummy bug or something like that? Are you thinking that you're going to die, or is it you just can't explain it? Yeah, so you just can't understand it and explain it. Okay. How much is that affecting your life? So does it take up a lot of your time, or does it come in waves? Okay, so what kind of things trigger it then? Yeah, so if you hear somebody's poorly, yeah, makes sense. Do you have any other rituals at all? Okay, so wobbling the gear stick. How many times in particular? Okay. Just say you're quite a perfectionist. Any other rituals? Yeah, saluting the magpies. To be honest with you, I do that as well. I salute the first magpie of the day. And before I used to salute every single one of them. It was just ridiculous. So I sympathise with you. Okay, anything else? Okay, so the other side of it is you like things neat and tidy, straight lines. Okay, and do you get annoyed if they get moved? And what do you think's going to happen if they're moved? Okay, so you don't necessarily think anything, okay. But it just bothers you. Okay. And then would you have to correct it? That makes sense. Do you hoard things at all? I mean, if you've got a lot of clutter at home, or do you feel attached to things and you don't like getting rid of them, or are you okay at throwing things out? Okay, so quite the opposite then, really. Yeah. Wonderful. So you say you've got thoughts of harming yourself, but what about others? Okay, that's good. Would you say you've got a lack of interest in doing anything, any activities or hobbies or things that you would possibly do before? What kind of things would you do before? Seems that a lot of this has been going on for such a long time that it's kind of sort of hard for you to kind of separate, if you like, when things started. I mean, some people have like bouts of things trigger things, say like a bereavement, and then that will trigger off. Other people have got things that just have always been kind of there but never kind of recognised, if you like, and it's just escalated. And I'm thinking that's more where we're looking at here. Okay, but let's carry on. So you mentioned about your teens. Okay, what happened there? Have you had any other traumatic events happen? Anything at all? And how old was that? And okay, so that was fairly recent then, was it? 2000? Okay, 15, that one. Have you ever been in the armed forces at all, or the police force? Do you get anxious around other people? Would that be always? Do you experience low mood? How often? Okay, so is that pretty much constant then? So you would say you feel quite depressed. Do you ever have bouts of being hyperactive? Okay, so would you say sometimes it swaps? How regular? Okay, Okay, so we're talking quite quickly swaps, not say days or hours. We're talking, could be like 5 minutes, and then you'll feel something else and your mood will swap into something else. Okay, so it's quite quick. Do you feel stressed at all? By anything in particular, or so not understanding what's going on? Yeah, okay. Do you feel any sadness? How often? Yeah, so quite a lot. Would you say you cry a lot then? And what, easily? Yeah. Okay. Right. Do you have any feelings of worthlessness and useless? Okay. And how often? What about emptiness? Yeah. It is, isn't it? It's just a hard one to explain, but that feeling of being empty and like something's missing, that missing feeling doesn't go. It's such a weird, suffocating feeling, isn't it? Yeah. And you get that just a lot, and sometimes it's worse than others, yeah. Okay. So the emptiness is quite a powerful feeling, isn't it? Okay. What about lonely? So, are you lonely when there's people by you, when you're with family, friends, or do you just always feel lonely? It's strange, isn't it, when you say, well, I'm feeling lonely, and then people go, but I'm here. But it doesn't matter, does it, if they're there? You still feel lonely. Yeah. You could have a house full of people and you could still feel lonely. Yeah. Do you have that feeling of pending doom? Yeah, so you always got that. You think something bad's going to happen, and you're like always waiting for something to happen. It's lingering, a sensation. And that's, again, it's quite suffocating, isn't it? And it's quite linked to the emptiness. So that bad feeling when you get that, and it can be quite emphasised. Yeah. I would ask if you feel misunderstood, but you did say that earlier. Do you ever get paranoid at all? I know that can be quite a broad spectrum, but do you ever worry about, or do you ever think that people are talking about you? Do you feel like nobody cares about you? Everyone hates you? That you can't do anything right? And you feel like it's always you that seems to be hated, that nobody likes, no matter what. No matter what you do, it's just never good enough. Yeah. Do you ever feel like you're being watched, being followed, or do you ever worry, say, your your friends hate you, or your family hate you, and that, you know, just paranoid about anything in particular. Okay. Now, do you ever get jealous? Now, I don't necessarily mean get jealous of somebody and that you want to be them. I don't necessarily mean that jealous, but do you experience that? Okay, it's not particularly. Okay, so do you get jealous, say, of if you're in a relationship? Say, are you jealous of them having a relationship with somebody in a friend way? So, for example, I'm going to use myself as an example. So, my partner is at work and he's quite friendly with, say, the ladies, but I don't necessarily mean in a flirty way or anything like that. Just platonic, you know, friends, work colleagues. But say I would then get jealous about them talking to each other. I think there's more going on, and I would think that they like them, that they're better than me, and that they want them. That's an example. Do you ever experience anything like that? Okay. And would you say you've got quite unstable relationships, or over your life, would you say that you in and out of different relationships, are you quite quick? Do you fall in love quite easily? So have you ever been promiscuous? So have you ever maybe just slept around, or you've got drunk and slept with different people? Have you kind of had unsafe sex and things like that, and you just haven't really been bothered about anything? Would you say you're quite a flirty person at times, or? Okay. I've asked you about drugs and alcohol. Do you ever do any gambling? Okay. Would you say you've got quite an addictive personality? So if you start something and you kind of get hooked on it and keep wanting it more and kind of get addicted to it, if that makes sense. Do you ever suffer with erratic behaviours? Like, do you want to go and drive recklessly, or just get really drunk, mega spending sprees? And how is it? The shopping, are you hooked on it? Okay. So with the shopping, you just like to buy things, makes you feel better, but then you feel guilty. Okay. So it's kind of like a vicious circle, isn't it? So that's like an addiction. Yeah. Have you felt as though your moods or your life were under control? Have you felt like you had everything under control and you're stable and you understand it? Okay. How frequently have you been bothered by not being able to stop worrying? Okay. I've asked you about the germs and the illness, repetitive behaviour. Talking about the repetitive behaviours, etc., would you say you're quite superstitious then? Okay. And we've said done multiple times, haven't we? We've talked about straight lines, talked about the mess, and comfortable. I've done that. Done that. Do you feel confident at all? Do you feel confident in yourself? Do you feel confident in who you are, in your own skin, and confident in the way you look? Okay, so it's straight up no for everything. Okay. So you'll say your self-esteem is very low. Okay. So you'd say you don't like the way you look. Why? What is it you don't like about yourself? I know you can say everything, but what is it? And that's what you think everybody sees. Well, I can tell you now, you are absolutely beautiful and you're perfect the way you are. But I know you're not going to believe me. All right. Okay. So when you get a compliment, does that make you feel awkward? And to brush it off. Yeah, I thought so with your reaction. So saying that, does that mean you can't see why people like you? Okay, so you just feel like they're lying. And then if they say things, you just don't understand why, that you can't see it. Yeah. So when you're looking in the mirror, what do you see? Obviously yourself, but what do you see? Okay, I get that. How many times have you felt satisfied with yourself? Okay. Do you feel like you can do anything? Anything at all? Okay. Are you capable of doing the things that you've wanted to do? So if you wanted to do something, have you been able to do it? So when you wanted to, but depend on how you feel. Okay, it makes sense. Okay. So you've mentioned about your future, you feel it's quite bleak, etc. So we don't need to ask about that. So you haven't got any hopes and dreams for the future, have you? Okay. So do you have any goals? Okay. Well, I can tell you one goal that you've got. Feeling better mentally. That is a goal. And you do because you're here. Okay? So, I'm going to ask you how you feel about working towards your goals. What feelings you have about it. Obviously, you said you didn't have any goals, but thinking of the one I've just told you, what are your thoughts with it? Impossible. Okay. Anything's possible. And we've mentioned that about your support network, don't we? Misunderstood. And you don't particularly feel supported, did you? That's what you said, yeah. Okay. You're doing really well. Okay. You feeling okay? You alright for me to continue? Okay. Right. Do you find it hard to trust anybody? How come? What do you think that is? Okay, so that's basically like we said before, out to get you, etc. Yeah. And you mentioned about relationships before, haven't we? So at the moment, how's your sex life? And would you say that's changed? Is there any changes? Okay, so a long time ago you would say swapping around, and now it's kind of like, can't be bothered. Okay. And is that because the way you feel, or okay, is it because of how you feel you look, or is it more to do with how you're feeling mentally? Okay. Are there any changes in your friendships at all? Okay, so you're not particularly trusting them, I suppose, and you're getting a little bit jealous of their relationships with other people. Okay, so that's maybe put a strain on the friendships. So what about relationships? partners, etc.? How's that? Is that very similar, or? Okay. Have you been involved in any important activities or projects? Okay. So you can't answer if they brought enjoyment to you. Okay. Do you use social media? What platforms? How do you feel when you scroll through? Okay. Do you feel like you're always seeking approval? Are you always feeling like you want praise? Are you always feeling like you want people to recognize you? Are you wanting to be accepted? Okay, and are you wanting to be better? Are you always kind of wanting to be better? As in, are you never satisfied with yourself? And you're always striving for that other thing? Okay. How frequently have you been doing things that mean something to you or your life? Okay. Have you felt bothered by tiredness or low energy? We've kind of touched on that, haven't we? How have you thought if people have let you down? Say you're meant to be going out somewhere and they cancel. What are your thoughts? Okay, so you think it's something you've done. Okay, and how would you react to them? Yeah. Okay. So I know you say you have that pending doom, so would that mean that you're feeling fear and dread, and how bothered by that are you? Okay. And we mentioned about you being restless for bed, but are you ever restless, just say if you're sitting on the sofa, you struggle to keep still, do you fidget a lot, or? Thank you. If you hear something bad, how does it affect you? So, say you heard somebody's broke up with somebody, how does that make you feel? Say if you are watching a movie or something and they're self-harming, or somebody has committed suicide, how does that make you feel? What about when somebody's, say, being abused? How does that make you feel? Okay. Do you think you are a good or a bad person? Okay, and why is that? Okay, so you would see, you know you're not a bad person, but you feel like you are because of, you think people think that about you, is that right? Okay. So you don't feel positive about your future. Do you feel positive about your relationships or interpersonal connections? Okay. Do you ever feel proud? And now is a moment you should be proud. Remember, you're here. Do you know what it feels like to be proud? Do Do you know what that feeling is like? Describe it. Okay. Do you feel like you belong? Or do you feel like you don't belong here? Yeah. Do you feel like you don't? Why do you think that is? Okay. So how do you handle obstacles that get in your way? So things happen, how do you deal with it? So say, I don't know, somebody has a go at you or criticises you or makes you feel worthless or something like that. How do you deal with it? Do you just break down? Do you cry? Do you think that the world's ending? What does it make you feel, and what do you do? And is it different every time? Yeah, I understand that. Okay. Yeah. Do you ever feel angry or bursts of rage? Anything in particular, or does it just come and go? So is that more you get angry about people, or? And is that because if they've done something, would you say, or you think they've done something? Do you ever lash out at people or objects? So do you ever get violent? Okay. So maybe smashed a glass or something like that. Okay. Is that very often or not particularly? Now I know what you're going to say to this, but do you like yourself? Do your actions matter? So the way you react to something, does that matter to you? And does it matter to others? Okay, why'd you say that? Yeah. Okay. Do you care about how people perceive you? Yeah, I knew you would say that, but I'm just checking. Do you ever feel confused? You're doing good? Great. If you've had a fight with somebody, or disagreement or argument or something, would you beg them to stay, cling onto them? Do you start fights, or do you track their movements and block them from leaving and stuff like that? All the time, or? So would you say you push people away, but then you kind of react and think, no, don't leave me, kind of thing? So would you say you're scared of rejection and being abandoned? And you might not necessarily think that, but if you get the negative comments and that makes you feel awful, and it makes you feel rejected, and say people criticize you and they say it's, constructive criticism, but clearly it isn't constructive. it's just pure offensive. I mean, if things are going to be pure offensive, it's going to affect anybody. But for you, if somebody criticises you, does that feel like all of your world has just come crashing down? And then you just start overthinking and thinking everybody hates you. And if people say are nice to somebody, or other people are getting the attention and having things off people and all this kind of stuff, but then you're not, do you feel like it's because nobody likes you? Okay. So we said about love, said about that. Do you ever see yourself as evil? Okay. Do you have a clear idea of what you want in life? And what about who you are? Do you know who you are? Okay. So you've got no sense of who you are, no sense of self. You don't know what you are, what you want, or anything like that. Okay. Have you changed jobs a lot? Changed friends a lot? Changed lovers a lot? Have you ever changed your sexual preferences? Can you stick to anything? Have you ever stuck at anything before? Okay, so tell me a little bit about that. Right, so you start a lot of things and then you give it up. Okay, so you're quite ambitious, so that's good. Creative, that's good to see you being positive. That's a good step. Yeah. Okay, and then you just never satisfied with that. Okay, so you say started a college course and then you swapped on to something else, then you want to do something else. You started a job but then you quit your job and you couldn't stick at it. Things like that. I understand. Have you ever done anything dangerous or criminal? Don't worry, I'm not here to judge. Okay. So have you ever done anything like shoplifting or binge too much alcohol and drugs? Done that one, done that one, done that one. Do you experience any hallucinations? So that could be hearing, seeing, feeling, anything like that. And we've done abandonment, rejection, criticism, we've done the mood changes, we've done what other people think, we've done about approval. So would you say that most of your relationships have been intense and unstable? Okay. Okay, so how do you feel about change? So if things change, how do you deal with it? Do you struggle to deal with change? And how does that make you feel? Okay, so when you say lost, do you ever feel lost in general? Like you don't know where you are, where you're going, and do you just feel lost? I get you. If you say your moods are swapping and changing, do you wonder why? And you're feeling like being tugged, like in a tug of war between different moods. I've done that one, done that one, done that one, done that one. And I'm guessing you're going to say yes to this, but you feel insecure in relationships. Can you just elaborate? Okay. Done that one. Done that. Nearly done now. Would you say you've got a short temper? Are you impatient? I know I've mentioned about anger and rage and things, but would you say you get more angry at yourself or at others? Do you ever feel guilty? What kind of things make you feel guilty? You mentioned obviously about the spending, but anything else? Okay. Do you get bored easily? Would you say you're dramatic? Okay, so you wouldn't, but others would. Okay. Yeah, I mean, it's quite offensive, I suppose. Some people find it offensive when they say you're dramatic. It's like that your feelings are invalid, that they're not worth anything, and you're just being over dramatic. When you're not necessarily being over dramatic, are you? That's how you're feeling, that's how you deal with it, that's what you feel like and how it makes you feel. And that doesn't actually mean that you're necessarily over dramatic or you are dramatic. You know, you can just be expressive, you know. I mean, would you say you're an expressive person? I mean, you've done really well today explaining things to me. So, you know, you're looking at me, and not necessarily always eye contact, but you're making that effort with me, and looking at you now, you're definitely a lot more comfortable than you were at the start of the session. Okay, but, you know, would you say you have black and white thinking, so it's either all or nothing, never an in between? Do you like to do thrill-seeking things? Would you say you're passive-aggressive, or wouldn't you really know? Does anyone else say you're passive-aggressive? Okay. Do you ever feel shame? What kind of things make you feel that? Do you ever feel bitterness about things or at people? So do you hold grudges? Okay. We mentioned about that and that already, that's fine. Okay. That's the main bulk done. Okay, this is in the last 2 weeks. The last 2 weeks, have you felt anxious, depressed, lonely, worthless, empty, sad, stressed? Urges to self-harm, suicidal thoughts? Okay. On a scale of 1 to 10, how depressed do you feel? Anxious, lonely, empty, sad, stressed, suicidal, wanting to self-harm? Okay. Angry, lost, thank you. I'm going to ask you something now. Do you ever dissociate, or as somebody said to you, disassociated? So do you ever feel like you're not in your own body? You've done something without knowing? Do you feel foggy, spaced out? Like it's all grey and in like a bubble or anything like that? Okay, anything in particular can you remember? Okay, and what happened then? Okay. Okay. Now, I want you to tell me, in your own words, how do you feel with your anxiety? Just describe the feeling. Perfect. And now, depression. That's very interesting. So you'll feel you're in a black hole, trying to reach out. You keep being sucked in. You feel suffocating and trapped and whirling, and to keep pulling you down and down, and you can't escape. It's very interesting. You wanted to stop. Would you say that the anxiety is worse or the depression? Which one bothers you the most? If you could remove one of them, which one would it be and why? Interesting. Okay, thank you. The depression side of it is very complex. Okay. A normal person's about here. Okay. Somebody, say, has a high or hyperactive, or somebody, say, with bipolar, you'd go up here. Okay. That's normal. Then when you have a low, you'll get low. Okay. And then some people get excessive low and drop. Now, I'm going to show you something. Okay, so you've got normal. There's such thing as normal, but I mean normal mood for most people. Here you've got high. Here we've got low. Here we've got very low. Okay, most people are about here. And then they drop to here if they're depressed. Here, say if they're hyperactive. Okay. Now, I think you are suffering with major depressive disorder. Okay. Now, I would say you have had bouts of major depression, but I think you've developed a disorder now. From what you've described to me, I think it's that. So, basically, you're always here. That's your normal. And then you drop. And you drop low. You're back there. You never are here. And sometimes you might be here, but I think that's down to you having borderline personality disorder. Okay, so you can be there, but then you'll swap there and back again. Now, I don't think you're bipolar because of how rapid these changes are. Okay. I also think you're suffering with complex PTSD from your child trauma, or should I say your teenage years trauma, and the sexual assaults that have occurred after that as well. Okay. And I think you have OCD traits, so I don't think you actually have OCD, but you've got quite a lot of strong OCD traits, and that could develop into it. I think that you may have had some social anxiety in the past, but I think yours is more generalised anxiety. Okay, so my diagnosis for you is major depressive disorder, complex PTSD, OCD traits, generalised anxiety disorder, and borderline personality disorder. And I think you meet a lot of the criteria for borderline. It's actually very high up there. You pretty much experience a lot, if not most, of the issues in that. You've got classic major depressive disorder symptoms. PTSD, from what you've described to me, is very PTSD related symptoms, chronic complex PTSD. And that is linking with the borderline. Okay, it's very crossed over there. And the generalised anxiety is you're not particularly anxious about something, it's just kind of overall, and it comes in waves. Okay, now it will be good for me to have a session with you to talk about these issues. So if we have a session, we can talk about major depressive disorder, we can talk about complex PTSD, we can talk about OCD, we'll talk about generalised anxiety, and we can talk about borderline personality disorder. Would that be something that you would be interested in? Okay, wonderful. Now I know this is a lot to take in. It's been very intense assessment today. And I just want to say that you have done absolutely marvellous. Okay, you are incredible. You should be so proud of yourself for today. Okay, give yourself a pat on the back. Brilliant. Okay, I'm really pleased and I'm very proud of you. And I think, you know, we can make good progress. All right. So this is what I'm diagnosing you with. Okay, and I want to start you on some treatment ASAP. So I'm going to pop you on antidepressants. I'm going to issue some lorazepam to help calm the anxiety attacks. Okay, I'm going to pop you on an antipsychotic and a mood stabilizer, which are anti-convulsion medicines. So they obviously treat epilepsy, but they're also deal with mood. And the antipsychotics, not because you're psychotic, it's just, you know, no, I don't think you're experiencing psychosis at this stage. There's a possibility you may have done in the past, depending on when you've gone in and out of hospital and things like that, but you haven't been given any long-term medication for that, so I wouldn't say that's necessarily an issue. And borderline personality disorder in itself has a lot of symptoms, and so does major depressive disorder. There's a lot of things that you're experiencing in each of those categories, and they are quite complex, severe mental illnesses. Okay, and I just want you to digest it and try to understand it and do some research, and I'm going to give you some information to go up and read about them. Can you tell me what your chemist is, where it is? What I'm going to do is I'm going to get your medication sent over directly to your pharmacy. Get them to pop in a leaflet, tell you all about them. I'm going to start you on a low dose and I'm going to bring you up. I'm going to monitor you for so long. If it's not really helping, I'm going to up you and up you, okay? There's all sorts of different medications that we can try, and I would suggest possibly having some talking therapies, maybe some DBT, EMDR therapy and stuff like that. Okay, sometimes it's very rare, but some people are lucky and, you know, medication is enough. Sometimes we need a little bit of both. Sometimes we need like specific kind of treatment therapies and things like that, okay. But I think the next time I see you, we can go over your diagnoses and I can talk about advice. I can talk about things, how you can help yourself and things like that. And we can really divulge into the disorders and come up with, you know, a good treatment plan, and we can help along the way. How does that sound for you? Perfect. Brilliant. Do you have any questions for me? Okay. No worries. Excellent. Thank you so much for being here, being honest and open with me. Definitely makes things easier. All right. You're very welcome. So I'll let you on your way. Start taking these medications as soon as you get them. And I would like to see you in 2 weeks, if that's possible. Okay. And we are then going to go over the diagnosis, etc. Wonderful. You're very welcome. And just remember, it's okay to not be okay. Don't be afraid to be yourself. You can do anything you set your mind to. Be brave. Be you. Own it. Love who you are. Because there's only one of you. And you matter. You matter to me. Okay, and I appreciate you so much. Okay, just remember that. You matter. You are appreciated. Okay. All right. Just remember that. Okay. You're welcome. You take care now. Bye-bye.